Aloha. So, thank you for joining me today. My name is Dr. Catherine Taketa-Wong, and for those of you who aren't familiar with me, I'm a naturopathic physician and acupuncturist. And for those of you who aren't familiar with naturopathic physicians, like medical doctors, we have to attend a 4-year medical school, and we're trained as primary care physicians, and as such, I can order lab tests, write prescriptions, and do school physicals just like other doctors. However, a big difference is that naturopathic doctors are trained in the power of nutrition to build health from the inside. And I use personalized food recommendations, vitamins, herbs, and other types of natural medicines to address the underlying causes of disease and treat the whole person. I also have a master's degree in Oriental medicine, which allows me to include Chinese medicine and acupuncture in my treatment protocols. So before we begin, I wanted to let you know that if you have health concerns that you'd like to talk with me about, we offer a no-charge phone consultation called the Personal Health Strategy Session. This is a 15-minute strategy session where we can talk about your condition and come up with a plan to see how I can help you the most. Arranging a consultation is very easy. Just call our office at 808-425-2987 and let our staff know that you're interested in a no-charge phone consultation. Okay, let's get started, and please feel free to use the comment section to ask questions as the talk progresses. So today we're going to be talking about some health issues that many women commonly deal with. And I'm talking about a lot of the menstrual issues that come along with being a woman. So this can include PMS, menstrual cramps, headaches around the time of your menstrual period, and also perimenopausal issues and menopausal symptoms. So as women get towards the end of their childbearing years, then there often tend to be a lot of really annoying symptoms, and this can go all the way up to significant and pretty severe. So with menopause, many people are often familiar with hot flashes that occur, but there can also be anxiety, depression, changes in mood that can sometimes be very significant and can really affect a person's ability to be able to function in their day-to-day life. So I found that most people have no idea that there are natural things that we can do to treat all of these things. Because most people go to their OBGYN and the only thing that they're offered are maybe birth control pills, and that may be all that they know. And many women just aren't familiar with the idea that natural medicine can very often effectively treat many of these concerns. And so that's my main take-home message for you today, is to let you know that there are a lot of things that can be done naturally to help treat all of these types of symptoms, and that it doesn't have to be just drugs or hormones, that there are other options. So, also in terms of other types of medications, like for menstrual headaches or migraines, the same, likewise, many people just think, okay, well, there's only just drugs and that's it. I go to my doctor and they just say, oh, I'll take ibuprofen, or if it gets really severe, really debilitating, then they might give me a migraine medication to help in terms of the pain. And that can help in terms of the pain, but my question is, why is someone having those symptoms in the first place? Because their body will always let us know if there are things that are out of balance, and it'll try to communicate those things to us. And so you're not just going to get a symptom that just comes out of nowhere. There's a reason for that, and our body's trying to tell us something is out of balance. And so as a society, many people don't know that we can actually prevent these kind of symptoms. You don't just have to wait until your headache comes on, that you can actually do things to prevent that. So I think it's unfortunate that the vast majority of women think that the only choices that they have are either taking drugs or just suffering with the symptoms. So, let me just say that absolutely, yes, there are options besides painkillers and hormone therapy. And there are other things that can really help, that are natural, that are easy on your body, and without the damaging side effects. So before we kind of jump into all of that, I wanted to share my own personal story about my journey with women's health conditions. When I was in naturopathic medical school, I had these wildly irregular periods, and I never knew when my period was going to come. And I could have a 30-day cycle, and then a 48-day cycle, and a 16-day cycle, and my period was just all over the place. And I would spot for 2 weeks, and then I would bleed, or I would have my period, and then 2 weeks later, then I would start to spot again. And so, I just had these very irregular periods, and I had a whole bunch of tests that were done, and they found that some of my hormones were low, but there wasn't really any specific diagnosis. My thyroid and other things were fine. But the tests did find that I had a sensitivity to gluten. So at that point, I took gluten out of my diet. And I also started seeing an acupuncturist regularly. And so I would get acupuncture regularly every week, and started also taking Chinese herbs that were prescribed to me. And my periods normalized pretty quickly. Within a few months or so, I stopped having these really irregular periods, and I started having more normal cycle, more regular cycle. And I would say within about 6 months or so, my cycle became regular and stayed that way ever since. So I can definitely say that I know that natural medicine works. And so let's just start with some of the basic kind of things that I like to talk about. So in terms of, treating things like PMS and menstrual headaches and menstrual cramps, all these kinds of things, most people don't realize that diet can actually be a huge part of that. And I have seen some women who have just cleaned up their diet in terms of just taking out soda, junk food, the candy, all the processed food, and didn't really change anything else. And I've had some women just from that alone, where their periods, in terms of PMS, the mood swings, the menstrual cramps, has improved dramatically. And so sometimes it's just as simple as something like that, because there are many additives in the foods that we eat today. Everything from preservatives to MSG to artificial dyes and artificial flavors. And some people are really sensitive to those things. And I've seen them cause headaches. I've seen them cause hormonal imbalances. And so that's the first thing, the foundation. And I have some of you might be saying, but you're crazy. I just crave chocolate all the time. It's impossible. And there can be reasons for that too. Sometimes there are blood sugar imbalances that cause you to crave sugary foods all the time. There can also be not enough of some nutrients. Like there's, for example, a nutrient called chromium, which is really important to help you keep your blood sugar balanced. And if you don't have enough chromium in your body, then you could actually be getting sugar cravings a lot more than you need to be. So it's a process, and I really like to do a lot of detective work in terms of trying to figure out, okay, what's going on. If women are getting sugar cravings all the time, then there's a reason for that. Sometimes there are issues with yeast infections, that people have an intestinal yeast overgrowth, and yeast feeds off of sugar. And so very commonly I have a number of patients that have an overgrowth of yeast, that if we help to treat the yeast infection or the overgrowth of yeast, then oftentimes their sugar cravings will decrease dramatically once the yeast is taken care of. So there are reasons, and it's important to have a good doctor who's going to be able to look into figuring out what are the underlying causes, rather than just treating just the symptoms. So, but diet is a foundational kind of thing. And I know it's not easy to change your diet. It certainly wasn't easy for me to take gluten out of my diet, but it's a process. And so just start where you're at, and just try to make slow, simple changes. Um, and so again, the diet is, one of the most foundational types of things. So I have some women who just started eating a lot more vegetables and just weren't eating junk food all the time. And then I've seen some women who that's been a really foundational thing. So again, just working on trying to get all the junk food and the processed foods and all those things out of your diet can be a significant help. Another thing that we will look at is testing the hormones and trying to figure out what are the hormonal imbalances. For most women who have a lot of PMS or menstrual symptoms, where they have menstrual cramps or they have menstrual headaches, or they're really moody or grouchy or depressed or anxious, or they're really tired all the time around the time of their period, then very often there can be hormonal imbalances. The most common one that I find is that there tends to, in general, be too much estrogen and not enough progesterone in the body. And so there are herbs, there are vitamins, homeopathic medicines, acupuncture that can be used to help to bring those hormones back into balance. And so I find that using a lot of those things are a very gentle way to help encourage the body to come back into balance, to have those hormones be more balanced, and that often women will start feeling a lot better. If you notice that you're tending to feel tired a lot, especially when you start to bleed around the time of your period, then you really should be checked to make sure that you're not anemic or that you don't have an iron deficiency. Because that's one thing that can be overlooked, especially in women who tend to have really heavy periods. And I find that some doctors will check to make sure that they're not anemic, but they don't check their actual iron levels or their iron stores. And I find that some women, they may not be anemic, where they have critically low levels of blood in their body, but they may have low levels of iron, or they may have low levels of their iron stores. And so if they don't do something to try to build those iron stores back up or to replenish the low levels of iron, then they could become anemic. And so that's a common thing that really should be checked, especially if you're tending to feel a lot more tired around the time of your period, and especially when you start bleeding. So another thing that we like to look at both in Chinese medicine and in naturopathic medicine is the liver. So the liver is responsible for helping to break down toxins as well as hormones in the body. And if there are problems with the liver's ability to break down toxins and get toxins out of the body, then those can start to build up and can start to cause problems. So one of the biggest culprits that's really present almost everywhere in our society today is something that's called BPA. This stands for bisphenol A, and bisphenol A is a compound. It's a toxin that's used in plastics manufacturing, but there are a lot of different sources of BPA. I see a comment over here by Iris. Yes, there's so many pesticides on the veggies out there. So definitely, yes. And a question over here, are RA symptoms able to be managed with nutrition? So RA standing for rheumatoid arthritis. And so that's a kind of a side note from our topic today, but I will say that in terms of rheumatoid arthritis, I've treated a number of patients with autoimmune issues, including rheumatoid arthritis. It is possible to manage symptoms with just nutrition alone. There are some patients that have very significant rheumatoid arthritis where we often need to use a lot of other things besides just nutrition to be able to manage their RA symptoms and to get the levels of inflammation down and to help their symptoms be more manageable. So nutrition is always foundational. That's really important. And I would say for some people it is possible to manage RA symptoms just with diet alone. Other people need a lot of other interventions to be able to get them feeling better. So kind of going back to what I was talking about in terms of BPA or bisphenol A. So this is a chemical that is very clearly associated in the research with a number of hormonal problems. It's associated with infertility as well as other types of hormonal conditions and certain types of hormonal cancers. It's also been associated with autism, with ADHD, and a number of other conditions. So it's not just causing hormonal problems. But in light of our topic today, that's a big thing that I want to bring up. And BPA is found in many products, but the most prevalent is in plastics. And as you probably well know in our society, plastic is everywhere. So BPA is used in the making of plastic. It's also in the lining of canned foods. So I would say it's difficult to avoid it entirely, but there are a lot of things that we can do to protect ourselves and our family. So one of the things is that we can use glass or stainless steel food containers, stainless steel water bottles. Even for babies, they do have stainless steel baby bottles with silicone nipples instead of plastic nipples. And so also trying to get fresh fruits and vegetables as much as possible, and trying to avoid more of the packaged foods. A big one that I'm always surprised at how many people still don't realize this is to not microwave your food in any plastic containers. Definitely don't heat any types of plastic where your food is there, because that's a definite way to get the BPA and other toxins that are in the plastics. They will release quite a bit more with heat. And so definitely don't microwave any plastics. If it says microwave safe, that doesn't mean that it's safe to microwave the plastics and that no toxins are going to come out. Microwave safe basically just means that that type of plastic is not going to melt in the microwave. But it doesn't mean that toxins won't be coming out. So just because, again, it says that it's microwave safe, don't microwave any plastics. And in general, even the American Academy of Pediatrics recently came out with a statement where they were concerned about the plastics that are being used, the plastic and the Tupperware containers that are being used to store so many children's food, because it has been shown that even if you're not heating the plastic, that BPA and other toxins in the plastic do get released into the food. So again, I have a young son at home, and so we try to use a lot of stainless steel containers and bowls and things like that. So that's one thing. And BPA is also present in cash register receipts. So try not to get the receipts or throwing them away, making sure you wash your hands after you touch or handle cash register receipts before you eat. So that's a big one. And so that's just one of the many toxins that are present in our environment that can be associated with hormonal problems. But another thing that we want to do is that we want to try to help to support our liver's ability to get toxins out of the body. So there are certain herbs and foods that are very helpful to support the liver. So, for example, some foods that are helpful for helping to support liver function, there's a lot of greens, but particularly if you can grow dandelion greens. Dandelions grow as a weed, so they're very easy to grow if you have a yard. And you can actually pick the greens and put them in salad. So dandelion is something that's very helpful for liver function. Other foods that I often like to recommend that people eat, so a lot of the greens, so kale and arugula, and a lot of the other types of greens, those are often really helpful. Beets are also important to help support liver function. Also herbs like ginger and turmeric. Those are very supportive for liver function. So what I usually do is we will get ginger or turmeric root, and we'll get them organic, like from the farmer's market, and then keep them in the freezer. And then what I'll usually do is then I'll take it out and then I'll try to grate some into stir fries or soups or other kinds of foods that we're making. You can also make teas out of them and then sweeten them with honey. And then some other foods, artichoke is another food that's really helpful for helping to support liver function. So you really want your food basically to be your medicine. Um, and so those are things that can be very important. And there's a number of other foods too that are really helpful for helping to support liver function. So another one is milk thistle. That's helpful for liver function. And basically the foods that are high in vitamin C, vitamin E, and zinc. There's too many foods for me to list here, but there's a number of foods. And so all of those are helpful for supporting liver function. And so again, because our liver has to break down all these toxins and get it out of the body, doing these kinds of things to support liver function is just something that's going to be helpful. And I also use homeopathics and other kinds of things to support liver detox, because our liver, as I mentioned, is also responsible for helping to break down hormones. If there are excessive levels of certain hormones, the liver has to break those down. And if the liver has some issues, then that's going to make it more difficult for the body to balance the hormones. So that's another thing that I like to look at. Another way to support the liver is to just avoid toxins, especially things like heavy metals. So lead and mercury, arsenic, those are examples of heavy metals which are extremely toxic to the body. And you would be surprised how many times I see people that come in, how many times I see women who come in with menstrual headaches and migraines, where they have very painful periods, and no one has ever checked them for heavy metal levels. And so I like to check for heavy metals, looking at blood levels. Also, I'll often check urine or sometimes hair tests as well. And when I do a urine test, I will usually try to do a 24-hour urine collection, because that's going to be a much more accurate way to check for heavy metals than just doing a single urine collection. And a 24-hour urine collection will be a better sample, because you'll be able to check to see if there are levels of heavy metals that have built up in the body over time. And you would really be surprised at how many people come back with high levels of lead, mercury, arsenic on blood tests or on urine tests. And so there's a lot of different sources where we can get exposed. A big one for mercury are the fillings that are used in dentistry. So the amalgam fillings, they're also called silver fillings. And I would say I have seen so many people where they come in and they have silver fillings, which contain mercury in them, or amalgam fillings. And they were told by their dentist, oh, no, it's not a problem. Don't worry about it. And yet when we check them for their levels of heavy metals, either through hair or through blood or urine, we find that their mercury levels actually are elevated. And that so clearly, the levels of mercury are elevated in the body, and that they are absorbing some of that mercury through their fillings. And those mercury fillings usually won't release huge amounts into the body all at once, but over time, over many years, that can build up. And every time we chew, then that will release some of those mercury fillings. And I will tell you, I've seen so many people where we test their levels, we find that their mercury levels are high, and then they have those mercury fillings removed by a dentist who's properly trained. And then we recheck them, and then their levels have gone back down to the normal range. So I do know that it is something where they can be where we are absorbing that mercury into our body. So, so the mercury fillings are a big one. So definitely really try to go with dentists who don't use mercury. I often will recommend what I call biological dentists or holistic dentists. So there's a number of really good holistic dentists here on Oahu. I often recommend Tony Kim or Chad Kawashima, and there's a number of other good dentists as well. But if you're going to have mercury fillings removed, if you do have mercury fillings in your mouth, it is important that you have them removed by a dentist who's properly trained. Because I have had people who've gone to dentists who are not trained in terms of proper and safe mercury removal. And if you have a dentist who doesn't remove them properly, you can actually get exposed to much higher levels of mercury in the process of having it removed. And I've had some patients who actually developed acute mercury toxicity poisoning symptoms where they actually developed tremors or cognitive changes, memory changes, and headaches or other kinds of things that happened after their mercury fillings were improperly removed. So it is really important to have a dentist who's properly trained. But so there is mercury. There's also mercury in some vaccines. I'm not saying that all vaccines are bad, but there are certain vaccines that do still have mercury in them. One of them is the flu shot. So I often encourage trying to get a flu shot if you are going to get it that does not contain mercury. I will say it tends to be difficult to find because most places all use multi-dose vials that do contain mercury. I'm just saying that I don't think it's a good idea to have mercury injected into the body, particularly if you do have hormonal symptoms or other kinds of symptoms that can be related to high levels of heavy metals. So again, you want to look and you want to test for sources of these heavy metals because these are all things that can be contributing factors. And once there are heavy metals in the body, then I will often work with women to get those heavy metals out using a variety of different things. Again, I use homeopathics. There's a number of other things that can be used to help to get mercury out of the body or other toxins like lead or arsenic. And I will say that I've seen a number of women that as we detox them, as we get toxins out of their bodies, we clean up their diet, that we definitely see clear improvements in their symptoms. They start to feel better. They don't feel as tired. Their headaches start to improve. And I've seen a number of women who have had menstrual migraines, some for even like 20, 30 years. And there's a number of women that we've been able to completely over time get rid of their migraines and where they don't have them anymore. But it is a process because we have to figure out, okay, what are the underlying causes for you? What are the things that we need to bring back into balance? And are there toxins that we need to get out of your body? But again, just know that these things are certainly very treatable. So this has just been a very short introduction. There's a number of other things. But these are just some of the factors. And also to mention menopausal kinds of concerns, there are a number of herbs and acupuncture techniques and other things that I find very helpful for many of the symptoms of menopause. So just know that, you know, if you're dealing with these things, it's not something that you just have to live with, that it is possible to get rid of those symptoms and by treating the underlying causes and bringing your body back into balance. So again, I just want to thank you for being here. Appreciate the opportunity to let you know more about the natural approach to women's health conditions. And again, if you'd like to arrange a personal health strategy session or no-charge phone consultation, for people interested in talking about a medical condition with me, it's really easy. Just call our office at 808-425-2987. You also find the contact information here on our Facebook page. So mahalo, and we'll see you again in 2 weeks. Aloha.